Hey everyone, welcome to another episode of Amanda's Mindset. I'm your host, Amanda Russo, and today I am here with a dear friend of mine, Sarah Arrowsmith, who I met at an ayahuasca ceremony in 2022, and I'm here with Sarah today.
Hi, everybody. Hey, Amanda.
Hi, thank you so much for being on the podcast.
Thanks for having me.
Of course. So, a question I typically like to start the podcast with is because I was once told that a lot of people often ask you when you first meet them, what do you do? And all they are really asking is, what can what you do help me with? So I decided to start reframing that question. And I typically ask my guests, who are you at the core? So who would you say Sarah is at the core?
I am at the core a very lovable being, a very loving being, who has oriented myself always towards taking care of others, um, who has studied in nursing. I'm a registered nurse. I'm a travel nurse as well who works in remote locations. I have expanded towards integrated energy therapy. I'm now a tier 3 advanced practitioner, and as well, just honest, hopefully honest always, and here, here right now. Very excited to be here right now. It's an exciting time to be alive.
I love that. It is an exciting time to be alive. So, can you tell us a little bit about how you got into nursing?
I got into nursing actually as a series of elimination, which is the weirdest way to go about it. I um, always had a knack with hands-on relief. I was young. I would sit on the back of couches and I would just put my magic little child hands on people's shoulders and just bring immense relief to my parents' friends. And then I was like, oh, maybe I'll go into a masseuse. And I realized that it involves touching strangers for countless, countless hours. And I thought, oh, maybe I don't want to do that particular branch of care. And then I was looking into chiropractists, and then I was looking into osteopractitioners, and could not sign up for the lengthy amount of study time it takes to be an osteopractitioner. If there are any osteopractitioners listening, I raise my hat to you. Beautiful work that they do. And then, end of high school, you got to go to college. Well, not you have to go to college, but, oftentimes there definitely was the encouragement for me in my life to go to college. I was like, well, nurse, you are taking care of people. It's, not too far off the beaten path, easy access. I guess we're going to go do this. And I've been doing it for 3 years now. And it's serving me well right now in my life.
Okay. It's serving you well.
It
Nice.
is.
I like that. Can you discuss a little bit about what energetic work you're getting into?
Yes. So, specifically, when we talk about energy work, oftentimes nowadays we're hearing about Reiki. Reiki is a great practice. I like to think of integrated energy therapy as a bit of a cousin to Reiki. It is also very much hands-on. We are working with what the integrated energy organization calls the 9 healing angels. I like to view them as a divine guides that kind of do a lot of the heavy lifting, if not all of the heavy lifting. You make a trust bond with a wonderful group of divine beings that are not here right now in the physical. They are elsewhere. And you get to kind of connect with them and go through, according to the 12-strand DNA model, go through different points in the physical atomical tissue, and go through taking guilt out of the top of the head, taking responsibility out of shoulders. And I think having a little bit of that, Western medicine practice, hearing that we energetically store fear where our adrenaline is produced in our kidneys is extremely interesting. I am energy sensitive. I am clairsentient, as I've come to learn throughout my own process, and stripping away of labels and stripping away of things that I was told, and kind of getting back to the magic and the mundane and what that feels like to me, and things that I capped and pick up on. And so, yeah, integrated energy therapy allows to reset karma. It allows to clear not just the physical field, the emotional, the spiritual fields as well. So yeah, it's been a good practice for me, and I've been able to do some serious relief on a couple of clients. So I've enjoyed that.
So how does it exactly work?
You The practitioner takes a moment to create a link to the divine healing energy, and then making a link with the person receiving the treatment. Usually going up physically if the person's in front of me, lying on a massage table that I have portable, so I can go anywhere with it and do private at-home sessions, going through starting at the head, and similar to Reiki, doing kind of motions in clearing energy. And so kind of going in, warming up any stored energy, for example, starting at the top of the head, that might be guilt, anything that you've lived that your body, your spirit, your emotions are holding on to that have made you feel guilt. Getting all of those, maybe sometimes traumatic energy, getting it ready to be dislodged, and then helping it be cleared away. And then as soon as we take something out, we put something back in. If you just empty a hole, what's going to fill back in? Anything. So we want to be putting the opposite of guilt in, which is just innocence, that we're just here and you've not done anything wrong. We're all just trying our best. And you go through all of the energy points on the body. It takes about an hour to do a whole session for me anyhow. And that's what kind of a session can look like.
Okay. Wow. So you described it as like a cousin to Reiki.
Yes, because I myself am not a Reiki practitioner.
Do you what do you know the differences between
Do I
that
know
and
the
Reiki?
differences?
Or what would you say? Do you know what they are? Or
I
what?
cannot be well placed because I am not sufficiently educated on Reiki to be able to fill that in. This is what IET looks like. Maybe you'll have a Reiki practitioner. Have you? I know that having received Reiki, it definitely is pulling energy, what seems like with hands, and like pulling it down and putting it back to the earth,
Yes.
which is
Yes.
what I seem to understand. With IET, it is like divine angels fill a room and are just clearing and taking it away into their voids, into their vortexes, not going necessarily back to material physical earth, but being taken away, which is a little like untangible logically, but if anybody's ever interested in just experiencing it and just seeing for yourself objectively, like, did I feel anything, hit up your local IET practitioner.
I love how you mentioned experiencing it and feeling it for yourself, because that is kind of a theme that I have emphasized with all things I've discussed on the podcast, is seeing for yourself.
Mm-hmm.
In terms of everything. Something could work so well for your spouse, your best friend, your mom, but maybe it's not for you.
Exactly. Exactly. And there's so many modalities nowadays. If you're interested in like human design, I've been hearing a lot of people going into this modality called human design, the Eckhart Tolle's, I think, a Power of Now, or School of Now, or School of Awakening. And there's just all of these better help, do your internal like spring cleaning, and like do the work, shadow work, whatever you want to call it, right? If you're just viewing it as Christianity, whether you're viewing it through Buddhism, you're viewing it through energy work, you're viewing it through psychology, like, I love what I'm seeing right now, which is that people are doing their work.
I agree. I
Uh,
agree. So how did you first discover that?
um, Doing the work.
No, that IET
Oh,
specific.
IET. IET, honestly, I had done Aya with you, and that summer was a craze. So much had changed, and yet like time stood still, but so much was going on. Um, I felt drawn to doing something with energy, but I definitely did feel like Reiki wasn't it for me. No hate towards Reiki, love Reiki. Reiki wasn't calling me. So it came to me. There was a Facebook ad of a lady who was teaching IET, integrated energy therapy. And I was like, what is this? I want to know. And then, yeah, she's excellent. Karen Mosuk in Montreal, love her, love her. She teaches Reiki. She teaches energy healing with pets. She teaches light language. Um, it's just this woman is divinely connected in all the ways. There's nothing she doesn't do. But yeah,
Wow,
that's
that's
how I got into it.
wow. And I love all that, but I also love how you touched on that you just weren't called to Reiki. Yes, you had great experiences with it, but again with everything, and I even emphasize about ayahuasca. If you are not called to ayahuasca, don't just go do ayahuasca. Because I I had heard about ayahuasca before, about a year and a half before I did it, but it wasn't in me. It didn't call to me. I didn't feel the feeling. Year and a half later, I just knew, just that knowing that this is for me.
I can I take a moment to like personal anecdote share what called me because I was not set out to do this major psychedelic event, which is the ingestion of DMT, which I afterwards we're going to segue through DMT towards death and dying and surrendering. But I was at my then fiance's parents' house. So I was at my in-laws, and my mother-in-law had just came home from her experience. Just driven home, had combo on top of it to top off the weekend, right? And just got home, still recovering from her weekend and the combo, and she's like, okay, I I'm this is what happened to me, and I'm gonna say it like once. And I might never be able to recount my experience as clearly as I can right now. And here's my experience A to Z. And the whole time she's talking, I had this just, again, I now can identify it as clairsentience. It was the first time it was happening to me, feeling this ball of very, very real just connection, like feeling a cord pulling me towards her from my solar plexus, from my gut, as she's talking about her experience. And I was very rarely through introduction of plant medicine, cannabis into my life at that point, having traumatic memories regarding unfortunate one-time occurrence that happened when I was younger that had resurfaced that I had forgotten about. And it was kind of going back between, did this really happen to me? Is this really a repressed memory that's come back? And I'm going through my own process at that point and hearing what my mother-in-law was saying and recounting her experience. And she was actually saying, grandmother Aya wants me to work with women that have sexual trauma. And I was like, oh my goodness, just this pull. And I'm like, okay. And then that weekend I was signed up. And I put it on my credit card and I paid it. And then we met. But yeah, that was the crazy. I did not see myself signing up for something like that, but I did. And I was really proud of myself too.
It's interesting you say that too, because when I had first got introduced to it, it was by my ex-boyfriend. We were together at the time, and two of his friends had gone to this specific retreat. And I was kind of judgmental about it. I it didn't really see it from the healing aspect. I saw it as you're doing drugs in the woods and puking. I don't want to do that. I'm a paralegal. I'm this. I'm not going to do that. And it just wasn't calling to me. But slowly as time went on, we broke up. A few months passed, I started hearing more about it, and I was like, huh, I wonder really what this even entails. Something was leading me to thinking, I should do this. And I was working at a job at the time that wasn't the best, didn't have a lot of work-life balance, no vacation time, I didn't get lunch breaks. And it was 3 weeks before our ceremony, my boss said to me, hey, the July vacation I'm taking in 3 weeks, I'm going to give it to you off too, and we'll just close. I registered that following payday and went to the ceremony. It was
And what a
just,
lovely soul family we've walked away with since.
I know, I know. Y'all are the best. It's been amazing. I
Sounds
love how you got into that too. I do.
yeah. DMT.
You
DMT
want you want to
has
touch on
been,
that?
yeah, as has been, probably repeated a couple of times, is a neurotransmitter that exists already in humans. Certain studies say that making, or certain claims that making the om sound can actually naturally increase your DMT production. Um, if not, out of sober mindset, let's say North America, you will naturally experience the experience of DMT twice in your life, when you're born and when you will die. As a nurse, I see a lot more death in my day-to-day life working with the general population, which is kind of getting up in age. A lot of my patients are between the ages of 60 and 90. Um, and I'm seeing a lot of end of life in our general aging population. And I guess if I get a chance to use this podcast to kind of voice something that I'm seeing, and that I want everyone to take a moment and kind of care about, is how do you want to die? You get to choose full consciousness, full willpower, how you want to leave this experience of being alive. How would you want to do it? And the reality, what I'm seeing is not best case scenario by any means. I'm seeing a lot of people elderly who are having, multiple diagnostics. Maybe you've got COPD, maybe you've got, high blood pressure. All it takes is one fall, and next thing you broke a femur, you're in the hospital, you're doing some rehabilitation. Best case scenarios when people are getting older, you're gonna maybe have a fall, maybe you'll get pneumonia, a urinary tract infection, as our wonderful grandparents and in some cases parents are getting up there in age. Um, and that's all that it can be sometimes, as we're getting more aged and more frail in our bodies. Um, and your care level is decided that it's a level D, which means that we are only doing comfort care. That looks like a Dilaudid, which is usually injected into the chubs. We put it in the subcutaneous fat. You can see scopolamine, which is a molecule that we're giving end of life to help dry out secretions. We're seeing sometimes Versed to help keep the person down under. And unfortunately, I'm seeing deaths that are very hard on family in an impersonal environment. We're at the hospital, and oftentimes your nurse has multiple patients, and we are trying to give you as much comfort as we can while still spreading our attention to other patients, other people that are sick and going through it. But you happen to be at the end of your life, which is such a privileged moment to be able to be the caregiver to someone who's experiencing their last experience here on earth. Is, I think, not given enough hype. It is a huge, huge deal. I also think energetically, karmically, on maybe a more esoteric spectrum, that having traumatic deaths or having deaths that aren't in the highest honor, or maybe deaths where people aren't getting the opportunity to exert their will, is maybe contributing to further karmic cycles of needing to continue to do the work as humans, because you're bringing it over. You're not closing chapters. And so I think closing chapters energetically, spiritually, morally, ethically, is something that we should be caring about a lot more. So I'm more familiar with Canadian medically assisted in death laws. In fact, Canadian Parliament right now is going through legislation right now so that we can have advanced directives so that illnesses like Alzheimer's, if you know you're going to no longer be you, and then you become, unfortunately, a lot of times the feeling that people have is that I'm going to be a burden to my family. I can no longer contribute to my own life, contribute to my own care, and be an autonomous person, and need to rely on other people to continue to live, but I don't have the right to die. And so advanced directives of being like, this illness, which will take me away, I would have advanced directives be able to imply that I'm ready for death, and get to choose which way you want to go. Certain countries have different laws anyhow. I think Switzerland had its first case of a non-immediately dying person that got to just get to old age and then choose to pass away because they didn't want to get to all the crappy stuff at the end. What, like, it hurts to walk and I can't breathe right anyhow and everything, like I can't do anything. I don't want to get there. Even if I'm still conscious, awake, and living every day, people want to choose the quality of life. So look into your legislation for your end of life rights in whatever governing body that you're residing in, whether it's the States or another country. Please make yourself aware, and don't be afraid to don't be afraid to initiate change. Yeah, thank you. That's something that I was really, really passionate about sharing. Yeah, end of life.
I have a lot of questions on that.
Let's go.
So I'll start with my first one. Would you say you enjoy getting to work with individuals at the end of their life?
I do. I really, really do. And it's as much about the individual as you get to be there for the families. Because the families are the one that are going to be left with this imprint of what it is to get to the end of the life. And so having mediocre deaths with healthcare, and this is not in every institution. This is no way like a blanket slate, like this is everywhere that you will go that you may risk having this encounter. Truth is, we are in a healthcare shortage. We need more nurses, we need more doctors, we need more caregivers, period. But from what I'm seeing, I can say that this is something that I do see happening relatively frequently enough. Being able to be there and having them not fear death. There's a lot of older generation that really fears death. We are afraid of dying. Having been to the other side and came back through ayahuasca, thank you, DMT, or people who've had near-death experiences, people who are very connected to spirituality or connected to the other side. I think it takes away a little bit of that fear, takes away a lot of that fear. And we've seen since I want to say the 60s or the 70s, US testing with LSD or with psilocybin and having beautiful, beautiful experiences that takes away fear of death. So psychedelics kind of go hand in hand with that as well. Although I wouldn't say that I personally am ready to have end of life ceremonies and be introducing certain plant medicines with that. But I would be curious to see how that would go. I'd be curious to see how that would go.
Me as well. So Would you say you agree or you disagree with medically assisted suicide?
I completely agree with it because I've gotten to live it firsthand. I've had patients that have had it, but most importantly, at the age of 21, I got to accompany my father, um, which his illness ended up being a blessing in disguise. Absolutely. Everything happens for a reason. I went from having a relatively absent father in my life, seeing him once every 3 years growing up because he lived at the other end of the continent. And getting getting the chance to have a relationship with him because he was starting to get sick. And I was 21. I had just quit nursing. I had almost finished the program. I myself was struggling through some mental health, and I was on the antidepressants, and I was losing the weight and redirecting myself. Where am I going to go? Um, Working this waitress job and really like stagnant. Not There was so much room in my life to be able to be like, okay, that's it. I'm selling my furniture. I'm getting rid of my apartment and I'm flying across the country and I'm going to go live with my dad and I'll be there until he dies. So be it. I'll be if it's 2 years, it's 2 years. If it's 6 months, it's 6 months. I'll be there. Um, and I got 7 months with him until his ALS, his Lou Gehrig's disease, had progressed to the point where he could no longer swallow properly. He could no longer use his vocal cords. The ALS Society of Canada donated so much wonderful equipment. He had a lift in his apartment to like hoist him up and put him in bed. He had an electric wheelchair. We had home care services 4 times a day. And I was the pivotal being in between all of this with him every day, making him supper and being like, Dad, it's getting a little harder to walk. We're gonna have to maybe up the services or like, do you need this and do you need more of this med? Okay, I'll call the pharmacist. Now I'll call the nutritionist. And um seeing to the point that he could have continued to physically live in what was a physical hell. I'm 100% for medically assisted death. And they have very, very thorough laws, of course, as the governing bodies are controlling kind of who gets access to this and who doesn't. Um, but it is beautiful. He got to pass away in the comfort of the family home, surrounded by his loved ones. On a Sunday, the doctor and nurse came to the house to give him the end of life. He got to listen to the song Time by Pink Floyd the way he wanted it, and got to fall asleep and then stop breathing, surrounded by his loved ones. And we got to plan his death before it came. We got to mourn his death before it came. He got to go through his 7 processes of grief before he died. And I think that's the best part of it, is that you really get the choice. I mean, we all know we're going to die. But getting to choose when and how, that's a privilege. But I think it should be more of a human right.
Wow. Can you discuss some of the emotions you felt during the 7 months being with your dad and leading up to it, and even once you guys made this decision?
Yeah. He made the decision and it was already like, I think it was definitely agreed upon in the family that we weren't going to let him suffer because he would have continued to live until usually, because ALS is like slowly paralyzing of a general effect. Your lungs will start to paralyze the same as you will lose control over your legs, the same as you will lose control over your sphincter muscles. Like everything is just slowly deteriorating until you are just completely paralyzed. And one day your diaphragm, will paralyze and you will consciously die suffocated if you go all the way out. So there was no way that he was going all the way out to that point if it wasn't something like, choking on your saliva and inhaling that and then getting pneumonia if it wouldn't have gotten him first. And I'm being very detached and being very medical about this, but this was my father at some point, and time definitely does help. It wasn't always this easy to talk about it. And It was difficult at first because I had an inner child to heal, taking care of my father, who was a stay-at-home dad. We had bees, we had chickens, you know, like I had a wonderful, wonderful upbringing with my father when he was in my life. Um, Getting to catch up for lost time, feelings of gratitude, I would say, that I was lucky enough that I could be there with him. Feelings of sadness and pain watching someone that I love, feelings of powerlessness because I could not do anything more than what I was doing. But I wish that I could have done more, you know, like had a cure or something like that. Feeling like it was unfair, but looking back now, you know, like 6 years later, I'm like, no, I think it was kind of fair. I think it was kind of fair, but you're going through it and it's not fair. And all parents die, unfortunately. Um, I'd say overall it was a really beautiful experience and I would do it again. And if I were to do it again, I would do it again differently. I think there's certain things that I would do um, a little bit more of, but really, really happy with what I did get with him. And I'd say it was probably 3 months before his death, because I didn't think he was going to make it to Christmas, and he made it to Groundhog's Day because of the movie Groundhog Day. He was hoping that if he maybe passed away on Groundhog's Day by some sort of magic, he could keep waking up and reliving the same day, just in case. But he chose Groundhog Day, and I didn't think he was going to make it to Christmas. He definitely pushed his suffering longer than he could have. So, and proud, and really proud. Yeah. I'd say it was one of my most beautiful and meaningful, right up there with ayahuasca, one of my, if not above ayahuasca, one of my most beautiful and meaningful human experiences was getting to be with my father for 7 months. The whole thing. It was great.
That's true. Okay. That does sound so beautiful. I love that. So, and only if you're comfortable talking about this, but if you're comfortable touching on, I'm a little curious, some of his feelings leading up
Yeah.
to.
I would say, having seen my father in his experience towards his end of life, one, it's like a reckoning. There's a recognition that, okay, it's not this, it's not that, it's really looking like it's this disease, it's terminal, there's no cure, it it's already been going fast, it's going to keep going fast. I'd say there was fear. I would say there was a re-questioning of faith and a returning to faith. um I would say that there was shame and there was embarrassment in the loss of autonomy, and being in his entourage as he's going through this loss of autonomy, as someone who was always very, very autonomous. He, you know, lived alone. He did his own things. He didn't need anybody. He could do it all, you know. Losing all of his abilities, definitely bringing him to some challenging feelings. Having his daughter take care of him in certain ways, definitely also challenging to, I'm going to use the word ego, but not necessarily in a like bad way, just in that recognition of self and being like, okay, this is where I'm at. Like, this is hard. This is a hard place to be at. Um, and I'm also going to guess, no, I know that there was a lot of love, because although he was going through this, he was getting to be with his youngest daughter again since childhood, you know. There was a lot of forgiveness and letting water under the bridge. Just, you know, it's gone. It's the past is the past, and we're just here now. And I'm a great young woman, and my sister is too. And there's no hard feelings that you were more absent than present for a majority of the life, and that's okay. And just what matters now is that we're together and we're making up for lost time, and I love you and he loves me. I actually feel him all the time now. I am really fortunate to have physical reminders of him, like pictures and things around me. But it's crazy how that ancestor realm, if you're just tapped in, like I feel him all the time. So, but those are definitely some of the challenging emotions that he went through. Shame, some guilt, and surrendering, because you just, life is going to happen, and it's happening right now, and that's what was happening for him. So yeah.
Did he discuss any of his feelings about it being planned? Like if he enjoyed that, if he had more fear with that? I'm just so curious.
I think the fact that it was planned was like the breath of fresh air option, because was the other option was not so great, but it was agreed upon within my family of confidential way that he was not going to be let suffer. And that was already decided upon. So it was a breath of fresh air that we got to do the good way, which is medically assisted death. Um, it was really a breath of fresh air. It had been talked about with a doctor pretty early on, and it was revisited, and all the papers were signed. And thankfully, some people with ALS can get like a dementia-induced ALS, which cognitively affects you, and you get confused. And if you're confused, you can't consent. So thankfully, we missed that one. We did not have to worry about his capacity of consenting being disrupted by pathophysiology of any sort. He was able to remain his mind intact and consent up until the end. Because if he would no longer have been deemed mentally intact to be able to consent or fit to consent, then you could no longer get to choose that option for yourself. So yeah, so we were really, really grateful. And he knew that he wasn't gonna draw it out. There was no way. He never shared specific fear. He shared curiosity. My father was a very curious man. He was, I think, excited to know in a certain way what was going to be on the other side. He was so curious. He wanted to go see, like when the time was right. But I also learned that my father was no stranger to plant medicines, so of the expansive kind. So I think that makes a lot of sense now that I piece things together. Not saying in any way that my dad did ayahuasca. I don't think he did. But definitely other psychedelic experiences, certainly.
Wow. So do you think there are any negatives or downsides to medically assisted deaths?
Do I think? All right. As a daughter of a father who got it, no. As a nurse who has seen it done in the hospital, do I think there are downsides to choosing this option for yourself? No, I actually don't. I can't see any negatives in choosing where, when I want to die, especially if something is coming and it is going to be terminal and I'm going to be perishing. Why not go before I am absolutely beyond miserable? Why would I make it all the way down that point? Death is inevitable, suffering is not. Like, you don't have to. And we have so much modern technology nowadays that we don't have to anymore. So I would say, as an option of the act of it, no. I would say that the legislation around it is definitely touchy, and is hopefully changing to, like I spoke about earlier, just advanced directives. Really something to think about.
Okay. Hmm. So I want to switch topics a little bit.
Let's go.
What would, I'm curious, if you had to give anyone in the world one piece of advice, the best piece of advice you could give them, what would it be?
Be kind to yourself and give yourself grace, and then give that same courtesy to others.
Okay, I like that. So I know we've touched upon this, not in the podcast, but just in talking. And we've talked a lot about intuition. And what is that face for?
That was the face of me getting into meditation position, like lifting up the leg, like, ooh, all right, intuition. Get ready.
Well, I'm just curious if you have suggestions or tips for people to tap into their intuition better.
Ooh, absolutely. Okay, we're going to start by removing things that are going to inhibit and block your intuition. I think everybody has intuition. I think everybody, I happen to believe in chakras. So I think everybody has chakras. This is kind of what I believe, but I don't push my belief onto others in no way, shape, or form. But energy and the way that energy kind of holds and the way that there are different types of energies, from your third eye to your solar plexus, definitely those are two major ones. What you put in your body matters. If you want a clean vessel that can capt more so, then fuel it with the most supreme foods, which is whole foods, whole ingredients. I would recommend staying away from what could be seen as kind of like bad energy foods. So anything that's overly processed, anything that is highly modified. And I would say things that continue animal cruelty chains, because food is energy. And if you have suffering in the energy of the foods that you're fueling in your body, I think it matters. So I would recommend probably staying away from pork, and just being mindful with beef. Beef in many cultures are sacred animals as well. Personally, I eat poultry, and I eat fish. That's what I eat. In no way do I think I'm better than anybody else because I do so, but that's just what I feel is right for my body. And there are certain like dietas as well when you're looking in the spirit world, like getting ready for ayahuasca, or things that are going to suggest that you cut out animal products. Yes. So if you believe in suffering and the continuation of energy, I think it makes a lot of sense that if there are animals suffering in animal factories and meat productions, that we're kind of absorbing that. So you can bless your food before you eat it. Or that kind of helps, blessing your food before you eat it, giving thanks for it. Like if you're going to eat something that's already dead and you didn't get to ask permission before you killed it, like in hunting, then according to certain like indigenous cultures, right, you will ask a great spirit, or you will ask that animal spirit before you take its life, for permission. In modern society, with how we get food from grocery stores, we don't have that luxury of being able to ask. So at least just blessing your food and giving thanks for its life before you eat it. So yeah, watching what you eat so that you have a clean vessel so that you can connect. And then I would say continue doing inner work, stripping away all of the stories you were told of how it's supposed to be, what you're allowed to do, what you can do. If you have limiting mindsets, maybe do some internal cleaning to help break free of those limiting thoughts, because oftentimes what's holding you back from tapping in is you. So I would say, yeah, working with, and just that, and meditate more. We should all meditate more, people. Slowing down the mind, getting right with breathing. I'm not the first to preach about it, but I just, yeah, helping your intuition. Eat clean, be nice to your body, and clean up your mind.
And cleaning up your mind, you would do that by meditating?
meditating, doing breath work is great, yoga is good. Journaling, if you need to sit down with yourself and really go over what is keeping me, what is holding me back right now, what are mindsets that are no longer serving me, what are things that I feel like was a label that was put on me, but that doesn't resonate with me, right? Like you were told who you were going to be before you got the chance to be. So who are you really? And if you're highly intuitive and that's part of who you are, reconnect back to those roots.
I love it. That's great. Thank you.
Thank you so much.
So, in terms of intuition, it kind of made me think of something else. But what would you suggest someone do if they are struggling to realize if something is right for them, whether it's a career, whether it's a location, maybe it's a job, maybe it's a partner? How can they intuitively tap in and know?
Ooh, I'd say it's a trust process. So if you want to trust, because oftentimes people will ask the answer, get an answer, and not like the answer and disregard the answer. So I'd say, firstly, do you
I'm
know that you
guilty
already
of that.
want an answer? I'd say first, know within yourself, do you already know what you want? Or do you know what it is that you think you should do? And then really just I'd say leave space for creative writing and journaling. Set a timer maybe for a minute or 2 minutes. Go up to 5 if you want, and just give yourself lots of space and just write. Don't stop, don't think, don't plan. Just let the pen go and narrate any thought patterns that are coming in. Narrate anything about the topic that you're going. That kind of might help you cognitively see where you didn't know you were necessarily at about the topic. I am a user of tarot cards and of divination through that form. If you feel connected to a form of divination, you can go to that. If you want answers from great universe, you can sit in meditation. You can, yeah, I would say meditate. It depends how big of a decision this is. If you feel like you want to go and have a ceremony, you can do cacao ceremonies. You can do music. You can whatever you feel called to go do that'll help orient you to a space that you can receive. If some really, really big changes in your life require there to be space for there to be changes. So you might have to get ready to make room for change. And you might be maybe having to get ready for the fact that something has to die for there to be a new start as well. So I'd say just leaving kind of like a blank canvas and seeing what pulls forward. But again, be aware of your own biases. You're going to get an answer that you don't want. Be aware that you might be blocking out an answer that you don't want.
That was a beautiful answer. Thank you.
Thank you, Amanda.
What would you say has been the best decision you've made in your life so far and why?
Oh my God. I would say the best decision I've made in my life thus far is to continue being with my life partner every day. I make the decision every day. I'm like, you know what, babe, we're gonna do this tomorrow. Yeah, let's do this tomorrow. He has been great to me. He has
I'm sorry, but the way you said that, babe, we're gonna do this tomorrow? Yeah, let's do this tomorrow.
let's do this again tomorrow. I married my best friend. I'm very great. I'm very, very grateful.
That's
I would say,
beautiful.
and this is like really just an individual. If other people resonate with that, that's great. I would say the best thing I've done thus far is continue to be with him because one, perseverance is a skill that I particularly am weak in. And so, we're 6 years in, so that's nice. In it for the long haul. He has led me to be so much more open-minded. I have come a long way. I have come a long, long way in how open-minded I've been, thanks to this particular human. I have been more patient. I have been a better giver of love in general as a person. I can hold more space for people. I have learned how to be just a better person in general, thanks to him. So, yeah. And everything that being with him has just brought through my journeying, just in association to him, or thanks to him, or with him, or after him, regardless. Um, yeah.
I love it. That's awesome. That is awesome. Okay. So before we wrap up, I'm just curious if there's anything I didn't ask you that you wished I would have.
Um, I I feel so happy with this interview. I don't feel like you missed anything. I think I got to say everything that I really wanted to share with everybody listening. Thank you so much for listening. I love you. And I'm really grateful. No, I think you've done a great job. And again, I love the community. I told you this off recording before we got to sit down together, Amanda. I love this podcast. I have been listening in, so grateful to be a part of it and to join in, to be able to have my voice be heard thanks to your platform. We need good, wholesome content, and I just love what you're doing here. So thank you so much.
Oh, my heart. You are so sweet. I do have another question. I just wanted to ask that before, but thank you so much. But I've got one more question for you. I wanted to approach the podcast in a way where it wasn't just questions from me. So I asked my best friend Andrea to come up with a question that I could ask any guest. And her question is, where do you hope to see yourself 3 years from now?
I love this question. Thanks, Andrea. In 3 years' time, I hope this would be the dream, okay? 3 years' time, I am the proud owner of like 200 acres in Nova Scotia. I've got this eco village, homestead, organic situation. I've got bee therapy. I've got sound therapy. I've got maybe in collaboration with some wonderful birth doulas that I know, have like ceremonies of birth, and I would be hosting ceremonies in death as well. I would love to have pottery. I would love to have my own eggs and chickens, and maybe we can do yoga with goats and breath work with goats, and lots of solar and clean energy, my own well, little yurt village. Could you imagine a little yurt village?
A yurt village?
A yurt village.
What is that?
Okay, yurts are like these tents made of like wood. They look like Mongolian little huts, and they're really easy to build. Like these cute little tiny houses made of wood, like hobbit homes, like a hobbit home lane. It would be so cute. So anyhow, eco village, the whole 9 yards. Healing out the wazoo, couples therapy with psilocybin, um, cannabis therapy, which is something that I'm quite passionate about as well, and my family and my husband, and hopefully twins. Why not? Let's go big. I want two in one shot.
You were so detailed. Have you?
I'm like manifesting this dream so hard right now. I'm like shopping for properties in Nova Scotia all the time. I actually am. I'm making it
Oh,
happen.
okay.
But that's where I want to be in 3 years. That's the
Oh my
whole dream.
gosh. It was just so specific. I'm like,
It
she
was
thought
very
about this
specific. I
before.
know. I actually wrote it on my paper of things to talk about. I was like, death process, maid, my dad, integrated energy therapy, Nova Scotia. If we were gonna get to it, I was gonna touch in on my whole plan. Got a whole dream.
Oh my gosh, I love it. Well, thank you so much for being on Amanda's Mindset. I super appreciate it. And I will leave all of Sarah's info in the show notes so you guys can find her and connect with her directly. And as always, thank you all so much for for listening to another episode of Amanda's Mindset. If you enjoyed the show, if you would like it, rate it, subscribe to it, and share it with somebody you think would benefit from it. Thanks, guys. Till next time.